Hey everyone, I'm David Finz, and on this episode of the Cyber Insurance Imperative, healthcare is back in the spotlight. This past week, news broke that another major hospital system, Ascension Health, had been hit by a cyber attack, disrupting clinical operations and leading the health system to notify its business partners to disconnect from its network. As of this recording, the hospital system was in the process of remediation and was working with Mandiant, a leading cybersecurity firm, to investigate the incident and determine what information may have been compromised in the attack. To its credit, Ascension did train its staff to handle such contingencies. And while one physician quipped to the Detroit Free Press that it was, quote, like the 1980s or 1990s because of the lack of access to computer records, care has continued for many patients, even if the process is a bit cumbersome. Ascension has acknowledged that they have been doing a bit of triage, diverting more stable patients to nearby hospitals for care due to the strain on their own resources from the network outage. Now, just to give you a sense of the scope of this incident, Ascension has 134,000 employees working in nearly 200 facilities spread across 19 states and the District of Columbia. So the care they provide touches a pretty significant portion of the U.S. population. These sorts of attacks are unfortunately becoming increasingly common in the healthcare sector, given the treasure trove of personal information providers maintain on patients, as well as the fact that hospital systems are incentivized to pay the ransom demanded by threat actors on account of the critical need to get back up and running. As far as who is behind the attack, multiple news reports are pointing the finger at the Black Basta ransomware syndicate, which both the FBI and the Cybersecurity Infrastructure and Security Agency, or CISA, say has been targeting U.S. critical infrastructure, including the healthcare sector, using spear phishing emails and taking advantage of known vulnerabilities in software. Now, that being said, Black Basta's site on the dark web has been mum about the attack, and as I record this episode, it's not clear whether Ascension has received a ransom demand or whether they would consider paying it. One thing is certain, though. Healthcare organizations need to have a plan in place to deal with such contingencies. And one very important component of that planning is to hold a tabletop exercise on at least an annual basis. This goes beyond the technical aspects of network security, bringing in all of the key decision makers from IT, HR, legal and risk management, even public relations. It's here that you will rehearse making decisions about whether to take down your network as a precautionary measure, how to communicate with each other and with key stakeholders during an attack, under what circumstances your organization would consider paying a ransom, and importantly, how to integrate insurance into your incident response planning. The Alliant Cyber Risk Consulting practice is available to help you with this process. Fees are surprisingly affordable, and the best part is you don't even have to be a current client of ours to take advantage of this separate engagement. Want to learn more about how a tabletop exercise can help you prepare for the worst? Please don't hesitate to reach out. You can DM me on LinkedIn or email me at david.fins@alliant.com, and I'll put you in touch with a member of our risk consulting team. This is also a good time to review your cyber insurance coverage because if you are a business partner of Ascension and was asked to disconnect from their network, you could be entitled to coverage for the lost income and extra expenses associated with this disruption to your operations, a feature known as dependent or contingent business interruption. This is an enhancement that is typically added to your policy by endorsement, so be sure to check those endorsements and not just the base form. It's important to keep accurate records of any outside vendors you engage to develop workarounds as a result of the interruption, as well as any impact on your organization's revenue. A forensic accountant can help you quantify those losses in order to prove them to your insurance carrier. In fact, many policies offer a sublimit to cover the cost of doing so. Our sister company, Imperium Consulting Group, is available to assist you with this process as well. And if your current broker isn't having these conversations with you, maybe it's time that you discover the more damage risk. Thanks for watching.